We present a case of an endovascular treatment of a right basilar P1 junction aneurysm in a patient with multiple intracranial aneurysms. The patient is a 47-year-old female with past medical history of sickle cell disease. She presented with chronic headaches, and during workup for these headaches, she had an MRI that demonstrate multiple intracranial aneurysms. There was evidence of increase in size of the basilar P1 junction aneurysm. Therefore, we elect for treatment. Patient elect for endovascular treatment. This MRA image, we demonstrate both posterior circulation aneurysms. In this case, we're going to treat the basilar P1 junction aneurysm. Under general anesthesia and after obtaining access through the right femoral artery, a 6 French guide catheter is then inserted into the left vertebral artery. The left vertebral artery demonstrates severe tortuosity, as you can see in these images. However, we were able to accommodate this 6 French guide catheter with no problem. Intracranial angiography demonstrates the two aneurysms. This 3D reconstruction demonstrates the short neck of the P1 basilar junction aneurysm that we are treating today. Once the patient is fully heparinized, we navigate the microwire and the microcatheter through the distal portion of the vertebral artery and into the basilar artery. We pass the wire carefully to avoid any injury to the small perforator vessels of the dorsal wall of the basilar artery. Under magnification, then we select the aneurysm. Multiple attempts with multiple wire shafts were performed because accessing the aneurysm wasn't very easy. We finally obtain access with the microwire, and then slowly and carefully we navigate the microcatheter. Once we have the microcatheter in the first and proximal portion of the aneurysm, we just slowly pull out the microwire, letting the microcatheter jump forward into the aneurysm. Once we obtain access into the aneurysm, the first framing coil is then deployed carefully, making sure that all the loops are within the aneurysm. Here the secret is to push the coil as slow as possible and let it take the configuration of the aneurysm. This is a lateral view of the aneurysm being treated. A second and a third coils were necessary to achieve complete obliteration of the aneurysm. Final runs demonstrate good obliteration of the right P1 basilar artery junction aneurysm.